You know how sometimes you just want to get right to the heart of a topic?
Mm-hmm.
Really understand it, but without, drowning in information.
Totally. Cut through the noise.
Exactly. And that's what we do here. We take a source, something maybe you sent us, and really dig in.
Yeah, we do a deep dive, pull out the most important bits, the key insights.
And today, we're digging into this really compelling article. It's called Turning Obstacles into Opportunities with Diversified Healthcare Perspectives.
Okay.
It's by Dr. Vivek Podder. He's a physician in Bangladesh, and it came out September 7th, 2022.
Got it. So, Dr. Potter, what's the mission for this one? What are we trying to understand from his piece?
Well, the core idea is to unpack the perspective he gained from being deeply involved in healthcare.
Ah,
But not just as a doctor. He was also a patient for a long time and a caregiver.
wow. Okay. So multiple angles. That's pretty unique, seeing it from all sides.
Right. That's what makes it so interesting. We want to see how those personal experiences, really intense ones, shaped his career, his outlook, everything.
Sounds fascinating. Where do we start? His early life.
Yeah, let's start there. Because
Yeah.
his early experiences were, well, they were pretty intense.
Okay.
For starters, he dealt with the wrong diagnosis for, get this, 23 years.
23 years. Seriously.
Yeah, and that meant tons of hospital visits long before he even needed his eventual heart surgery. So he was a patient, a frequent one, for a huge chunk of his life.
That alone gives you a certain perspective, doesn't it? Being on that side of the bed.
Definitely. And then, on top of that, he spent 14 years as the main caregiver for his father.
Okay.
His dad had really serious complications from diabetes that wasn't well managed, things like a bad foot ulcer with cellulitis.
Right. That's a nasty skin infection. Very dangerous with diabetes.
Exactly. Apparently, it was so complex, his mentor actually called his father a living Harrison's medicine book.
Whoa, like textbook examples of everything that can go wrong.
Pretty much. It just shows how immersed Dr. Potter was in complex chronic care from a very young age. It wasn't just theory for him.
No, it was daily life. Intense.
And then there's the healthcare access issue. His mother had a heart attack while he was away caring for his father.
Oh, no.
And where they lived, in a rural area, there just wasn't a facility nearby that could give her the urgent treatment she needed.
Like clot-busting drugs or PCI?
Yeah, thrombolytics or primary PCI, those critical things to open up the artery quickly, they just weren't available in time.
That's heartbreaking, and it really highlights the disparities, doesn't it, between urban and rural care?
It really does. And then there was the money side of things. The financial strain was huge.
I can only imagine.
He mentions taking out loans for 12 years just to figure out why his father kept getting these fevers.
12 years of loans for diagnostics. Wow.
And he also had to borrow money for his own open heart surgery.
So the cost of just getting care or even understanding the illness was a massive burden.
A massive burden. It really shows how health problems and financial problems are, so often tangled together.
Absolutely. You can't separate them.
And all this, his own health issues, his caregiving duties, it actually delayed his medical graduation.
Understandably.
So yeah, these early years, they really gave him this incredibly rounded and frankly tough view of healthcare. Patient, caregiver, future doctor, all wrapped up in one.
Okay, so he had all this direct, difficult experience. How did that translate into learnings, especially from the caregiving side?
That's where it gets really interesting. He talks about learning things you don't always get from books.
Like what?
Like the importance of just listening, really listening to the patient. Kindness, humility, empathy.
So so-called soft skills.
Exactly. But he saw them as absolutely crucial for healing. And patient education, too, empowering people with knowledge about their own health.
That makes so much sense. When you're the one giving care, you see how much that matters.
For sure. And it wasn't just the human side. He picked up a lot of practical medical skills, too, just out of necessity.
Oh, yeah. Like what sort of things?
Things like measuring blood pressure accurately, giving insulin shots, subcutaneous ones.
Right.
Managing diabetic foot care, which is really complex.
Very.
And even interpreting tests like ECGs.
Heart tracings.
Polysomnography.
Sleep studies.
Yep. And echocardiograms, those heart ultrasounds. He learned to read them.
Wow. So he was gaining clinical skills way before he even finished med school, essentially.
Absolutely. Just by being there. And he talks about gaining confidence.
Confidence in what way?
In managing his dad's condition day to day. The ups and downs, blood pressure swings, blood sugar changes, shortness of breath, fevers, weakness, dizziness, chest pain.
All the things that can happen with complex chronic illness.
Right. and often having to manage it with limited resources available, making decisions on the fly.
That's real-world medicine right there. High stakes.
Definitely. He also learned a lot about the importance of specific diets for diabetes and kidney problems.
Crucial areas.
And he saw firsthand the impact of complications like diabetic retinopathy, how it affected his father's vision, and the foot problems causing disability.
Seeing that day in, day out, it must leave a mark.
And get this, his father was on 14 different medications every day.
14. Wow, polypharmacy.
Exactly. So Dr. Podder got a very real, very personal look at how complex managing multiple medications can be, the potential side effects, the cost, the burden of just keeping track.
Yeah, that's a huge issue for many patients, especially older adults.
So that caregiving role, it was like an intense practical postgraduate course in itself. But his insights went broader too, right? Into societal stuff.
Yeah, he definitely connected the dots beyond just the clinical picture. He saw how things like, social factors and economic situations really tie into people's health.
Mental and physical health.
Both, absolutely. And he saw how important family support is, how having family involved can genuinely help the healing process.
That makes sense, having people around you.
But he also felt, very personally, the stress and the difficulty faced by caregivers in rural areas.
Right, because the good quality healthcare just wasn't nearby.
Exactly, that feeling of helplessness, the logistical nightmares, the distress. It's a huge issue that maybe doesn't get talked about enough.
And the emotional drain, the financial strain. He lived it.
He did. And because of his own family's financial struggles, he became very focused on finding ways around it, looking for cheaper generic drugs, figuring out health insurance.
So it wasn't just an abstract problem for him, it was survival.
Pretty much. It really underscores that idea of addressing the social determinants of health. It's not just about the disease, it's about the person's whole context.
Okay, so facing all of this, it's a lot. Years of illness, caregiving stress, financial worry, access issues. It could easily break someone, or at least make them quite cynical.
For sure, it's an incredible amount of adversity.
But Dr. Podder seems to have done the opposite. He turned it into fuel. How did that happen?
It really speaks volumes about his resilience, doesn't it? He says these experiences actually fired up his curiosity, his passion for medicine, his focus, his work ethic.
So instead of crushing him, it motivated him.
Deeply motivated him. Especially, he says, motivated him to help other people who were going through similar struggles.
Okay. So it became a driving force.
A very powerful one. And he didn't just feel motivated, he acted on it.
How so? What did he do?
He became a really active patient advocate.
Meaning?
Meaning he would help people navigate the system, like helping them understand their online health records, which can be confusing.
Right, yeah, definitely.
Finding ways to get high-value care that was also affordable, even helping organize crowdfunding for people hit with huge medical bills.
Wow. So using his own hard-won knowledge to help others avoid some of the same pitfalls.
Precisely. He wasn't just understanding the problems, he was actively trying to solve them for others. It's quite inspiring.
It really is. And he also mentions mentors playing a big role.
Yes, he credits people like Dr. Rakesh Biswas, Dr. Akshay Anand, Dr. Amy Price. He highlights how important that guidance and support was for him.
Which is always good to remember. You don't usually navigate these things alone.
Yeah, absolutely not. And this drive, this understanding born from hardship, it clearly propelled him into making significant contributions to the medical field itself.
Right. Let's talk about his achievements because they're pretty remarkable, especially given his background. He became an independent clinical researcher.
Yes, and medical writer, journal editor, reviewer. The output is impressive. Over 50 research papers and book chapters.
Wow.
Hundreds of evidence summaries. His work has been cited thousands of times on Google Scholar.
So he really established himself in the academic and research world.
Absolutely. And look at his editorial roles with journals like the International Journal of Medical Students, Frontiers in Public Health, BMC Health Services Research.
Those are respected publications.
Very much so. And he reviews for, I think, 13 different medical journals. That shows a real commitment to the quality of medical science.
Definitely. And he didn't just stay in publishing, right? He was involved in teaching, too.
Yeah, he worked as a scientific writer for the Joanna Briggs Institute and was a visiting lecturer at the University of Adelaide in Australia.
Spreading that knowledge.
Exactly. Plus, he was active in social work, presenting at conferences, running workshops, and importantly, mentoring students in research.
Paying it forward.
Seems like it. He also took on leadership roles in medical organizations, building this huge network nationally and internationally.
Which would obviously increase his impact.
Right. And he even won an Indian Health Innovation Award
Oh, yeah. For what?
for work on improving training for what they call last mile workers, those frontline healthcare providers in remote areas.
Ah, connecting back to those access issues he experienced himself.
It seems very connected, yeah. Very practical, very impact focused.
And wasn't there something about USMLE prep materials, too?
Yes, he contributed to first aid for the USMLE Step 1 and Step 2 CK.
Wow, those are like the Bibles for medical students in the U.S. and many other places.
They really are. So his reach extends even to how future doctors are trained.
That's incredible. And the final recognition mentioned is Sigma Xi.
Mm-hmm. Nomination as a full member of Sigma Xi, which is a major research honor society, a really significant acknowledgement of his contributions.
It all just paints a picture of someone who took immense personal challenges and channeled that energy into an extraordinary range of positive actions.
It really does. It's a powerful example of turning adversity into a force for good, not just for himself, but for the wider medical and scientific community.
So if we try to boil it down, what's the core philosophy here? What's the big takeaway from Dr. Potter's story and perspective?
I think the central idea he puts forward is that challenges, well, they're tough, obviously, but they are also fundamental opportunities
Opportunities for what?
for learning, for growth.
Yeah.
And he makes this really interesting point that the biggest gains often come not just from tackling your own problems,
Okay.
but from focusing your energy on solving the problems of others.
Ah, that's a powerful shift in perspective.
It is, and he uses this quote, apparently shared by Dr. Devi Shetty from the Upanishads.
What does it say?
It basically suggests that when you genuinely strive for the well-being of other people, it's like the universe or cosmic forces kind of conspire to help you succeed too.
So altruism isn't just good for others. It can actually help you achieve your own goals.
That seems to be the essence of it, that focusing outward can bring unexpected support and success inward. It's about interconnectedness.
That's a really profound thought. Okay, so wrapping up this deep dive on Dr. Potter, what are the main things we should take away?
Well, I think first is just seeing how incredibly powerful personal experience can be. His time as a patient, as a caregiver, it clearly shaped him as a physician in ways that just studying books couldn't.
Yeah, that deep empathy, that patient-centered focus seems really rooted in his own journey.
Exactly. And then there's the resilience factor, seeing how someone can face obstacle after obstacle.
Financial, health, systemic.
Right. And not just endure it, but actually transform it into motivation. Motivation to make a real difference.
It's pretty inspiring. And for you, listening in, maybe you're someone who wants to learn deeply, but avoid that feeling of being overwhelmed. Dr. Potter's story is such a great example of how one person's narrative, their lived experience, can give you such rich insights into something huge and complex like healthcare.
Yeah, it makes it relatable. It brings the data and the policies down to a human level. You understand the system differently through his eyes.
Definitely. So maybe a final thought to leave you with. Building on all this,
Okay.
think about your own life. What challenges have you faced or are you facing now?
Big or small?
Right.
Yeah.
How might those challenges be shaping how you see the world or a particular area you're interested in?
And maybe take it a step further. Could you, like Dr. Potter, find ways to turn those obstacles into opportunities?
Opportunities for your own growth, sure, but maybe also opportunities to help others, to contribute something valuable based on the unique perspective you've gained through adversity.
It's about recognizing how different viewpoints, especially those forged in difficulty, can really enrich our understanding and maybe even open up new paths for making a difference, something to chew on.